Hi guys, my name is Violet. Good morning to you all. Good afternoon, good evening, depending on the time you're watching this video. This is the second part of the previous video I made titled Little Mistake That Can Cause Infertility. So this is the continuation of that video. I did mention on that video So I did mention on my previous video that people with PCOS are prone to diabetes in the nearest future and how they can manage it. When you have a PCOS, you can start with going to the gym, or you can start with just doing the exercise in your home. Eat more of vegetable, reduce your sugar intake, and take your multivitamins regularly, so that can also boost your immune system and reduce the male hormone that is causing the PCOS. But it can be managed. Every woman has a PCOS, but it's just that some women have the higher PCOS. All right, so you can actually help yourself with those exercise, eat healthy food, and stay away from fatty food. Stay away from sugary food, so that can actually help. Another thing we're going to be talking about is cyst. Cyst is a cavity of abnormal character containing fluid. Sometimes it stays in your either right or left ovaries. Sometimes it goes away and sometimes it doesn't go away, and it's very painful. When you have cyst, you start feeling a sharp pain on your right or left hand side of your stomach. So that's when majority of those cysts goes away. It's a fluid that stay inside the sac. So when your egg release every month, that particular egg does not release. It stays there as a fluid. Sometimes you might have to go through a surgery to remove it. Sometimes they do it. So sometimes they can take your cyst out through laparoscopic. So it's like putting a hole through your navel and taking it out. But if your cyst is the kind of cyst that they can do through that procedure, they have to just cut your under belly. So then you have to go for it instead of waiting and say God will perform a miracle. By so doing that, you're wasting much time, So another thing I'll be talking about is your progesterone level. Some women, they like to douche. And what is douche? So sometimes they can take your cyst out through laparoscopic. So it's like putting a hole through your navel and taking it out. But if your cyst is the kind of cyst that they can do through that procedure, they have to just cut your under belly. So then you have to go for it instead of waiting and say God will perform a miracle. By so doing that, you're wasting much time, So another thing I'll be talking about is your progesterone level. Some women like douching, and it's very wrong. So if you want to wash your private parts, it's better for you to wash the vulva, the outer parts, those areas, because vagina is it has a self cleanser. It cleans itself. So you don't have to stick your fingers, your hand inside to wash it with either soap or water. By so doing that, you're reducing your progesterone level. Progesterone in a woman plays a vital role. When you are pregnant and your progesterone level is normal, it will be very difficult for you to have miscarriage. But when you are pregnant and your progesterone level is very low, miscarriage will become the order of the day, because progesterone helps the uterus to hold the baby, to hold your pregnancy. So if you are the kind of person that does every time you put your fingers into your vagina to wash out all the progesterone, it's very, very progesterone helps your body to prepare your uterus for implantation of a fertile egg. So by the time you wash them out, every time you wash out everything that is supposed to be preparing your uterus for implantation for the fertile eggs, preparing your womb, making your pregnancy safe. There are also tablets called progesterone. It also can help you protect your pregnancy and also prepare you for pregnancy. Some gynecologists will prescribe it for you to take. It's not you don't take it orally. I think you have to insert it into your vagina. I think once or twice a day, depends on your prescription. And mostly it's when you go to bed because it does melt, So if you are that kind of a person that have low progesterone level, I think you should talk to your gynecologist or talk to your doctor and get the tablets. It's not most. I think most progesterone you have to actually insert it. I'm not really sure about that. So that's another thing. So for ladies that doge, please, 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 you have to stop it. Vagina is a self cleanser. You don't have to put your hand inside and wash it out. Women who doge all the time, most of them end up with cervical cancer. Yeah, you can check it. You can ask your daughter, you can ask your gynecologist about what I just said now. Because when you doge often, doge can give you a cervical cancer. Yeah. So if you are that kind of a person that would doge once, twice, or 3 times a day, it's a no. Either way, you're trying to get pregnant or you're not trying to get pregnant, you still have to keep yourself clean. So vagina is a self cleanser. You don't have to stick your hand inside like I said before. And when you are the kind of person that doge all the time, it's going to be very difficult for you to get pregnant. Yeah, it's going to be very, very difficult for you to get. And also, dosing can give you an ectopic pregnancy. Yeah. And what is ectopic pregnancy? Ectopic pregnancy is pregnancy outside your womb, outside your uterus. A child that is supposed to be implanting inside your uterus now is in your fallopian tube. That is what is called ectopic pregnancy. And ectopic pregnancy can really be bad. Sometimes when a woman end up having ectopic pregnancy, sometimes one of their fallopian tube is being removed during that process. So you don't want that for yourself. So I'll advise you to stop dosing now that you already know that. So another key point that we'll be talking about today is how to boost your eggs, how to produce a fertile eggs. So like I said on my previous video, eating healthy can also boost your immune system. It can also help you to have fertile eggs. There are also some food that can also help you to boost your eggs and also to boost your husband libido. Okay, so like cassava, you can either eat the leaf or cassava itself. So cassava leaf, you can blend it, cook it just the same way you cook every other soup. If you are Nigeria or Africa or whatever part of Africa you're from, you can cook the cassava leaf as if you are cooking your black bitter leaf soup. So blend it, add whatever meat, spice, or anything that you want to add to it. Eat it with your partner. Okay, if your partner doesn't live in the same place with you, you can eat it alone. You can also tell him to also be eating it. If you don't want to use the leaf, maybe like a soup, you can also get the stem, the big one. In Africa we call it bobozi. So you can also prepare it and just eat it like a snack. It does help, trust me. You can go check it, you can ask around. Yeah, cassava is very good for fertility. It can also boost your ovulation. So another thing I would like you to know is that cassava can also give you twins. Yeah, when you eat more of it, like you cook the leaf, the stem, the big one that looks like yam, you cut it, you boil it and eat it. It can also help you boost your ovulation. It can also help you have twins. So that's it. Then on my next video, I'll be talking about more of the food that can actually help you to boost your fertility. If maybe you are not the kind of person that like to take medication, So on my previous video, I also was talking about the other partner. So if you are male or you are female, you are the only one going to fertility clinic, taking the fertility pills, you you have to get your partner involved, either the man or the woman. So either the man or the woman, both of you need the same equal treatment, unless you have been diagnosed that you are okay, then the other party can also continue the treatment. Other than that, both of you need to do the treatment together and boost your system together. While the lady is trying to get pregnant, boosting her eggs, you the man, you also try and take some pills, some medication that can also boost your sperm. Okay, because I've seen most cases whereby only the women is just being accused of infertility, while most other cases the men also is the cause of the problem. So if you are a woman and you are doing it all by yourself, you are not taking your husband along, it's not right. You have to get him involved. Let him go to see the gynecologist. He should also get his own semen analysis. They should get him checked to make sure he's not having infection, he's not having low sperm count, and is healthy. And also another thing that we also need to talk about is your blood group. Sometimes some blood doesn't just match. You might just see your gynecologist and they can evaluate the both of you and say, oh, okay, both of you are fine. But sometimes if your blood doesn't actually match, pregnancy becomes so difficult. Yeah. Another thing is when either of your partner have infection and you're getting treatment for it, not just only the man or the woman should get treated, because when you are having an infection, sexual transmitted disease, you should also know that your other partner already has it. So if you are the woman, you are treating yourself, you should also make sure your husband is treating himself, because when you end up treating yourself and you are okay and you go back and sleep with your husband, like have sex with your husband, it's just as if you didn't treat yourself, because you're still going to get infected again. And too much of it, like too much of infection, taking antibiotics all the time, can also cause delay in pregnancy, because the time you're supposed to be taking your multivitamin, trying to boost your eggs, that's the same time you're taking antibiotics to clear up your infection. So that's already is causing another delay. Time is going, so you should also get your partner tested for infection. And if also is infected, it has to also go to take treatment, and make sure during those process both of you are taking treatment. You have to stay away from sex, because you cannot be taking treatment trying to treat a transmitted disease and both of you are still having sex. The infection is not going to go away, the disease is not going to go away. So that is the time both of you should actually stay apart, stay away from. So you have to go back to recheck yourself to make sure both of you are cleared of the infection. Then both of you can start having sex again. So another thing I want to talk about, like miscarriages. When you keep having series of miscarriages, check your partner. Tell him to go again to have himself check. Because if your partner has infection, a transmitted disease, STD, gonorrhea, and many more infection and diseases like that, and you are pregnant, both of you are making love, that can also lead to miscarriages. So it needs to get tested. And also you also as the woman need to get tested. You have to check your womb, because sometimes when you keep having series of miscarriages, 1, 2, 3, 4, 5, it's not normal. It's not. So you might just be having a prolonged infection that you actually treated, but it's still there. So that also might be causing miscarriages. And also they have to check your womb. If your womb have a leakage, so they have to also check it. And your progesterone level, like I said before, they have to also check it, because that also can protect your baby when your progesterone level is normal. And sometimes for some cases, when they see that, oh, this person have had cases of miscarriages, they can also say, okay, when you are 12 weeks, you can come for to have a cervical cartilage. That is like sewing or stitching the womb to avoid miscarriages. So those are the things that you also need to put into consideration and also check out for when you're trying to get pregnant. Both partner also needs to reduce stress when trying to get pregnant. Try and have time for each other. Rekindle your love. If you want to go on vacation, go on vacation. Change environment. That also can also help when you're trying to get pregnant. Don't be far away from your partner. Okay? You guys should be into each other. Reduce your stress, talk about everything, give listening ears, share ideas together. That can also help the baby to come. So now let's talk about fibroid. If you were diagnosed of fibroid, that you have fibroid, multiple fibroid, one fibroid, or is big, you should know the size of your fibroid. So if your doctor has already advised you, your physician has already advised you that you need to get a surgery, you need to get it removed, why not do it? Why are you wasting your time? Why are you just there saying, oh, you don't want to do it? By so doing that, you're delaying. So get it removed. It's not a big deal. People get fibroid removed every day. So depending on where your fibroid is staying, there are some fibroid that stays in the uterus, there are some fibroid that is outside the uterus, there are some fibroid that is very close to your fallopian tube. Like I did my fibroid, mine was in between my fallopian tube and my uterus. I got it removed, and the following month I got pregnant almost immediately. When you get it removed, that will also enhance your fertility. It gives you more chance for the baby to come. Because probably if that is the case, if that is your case, that has been the problem, or you are pregnant and you end up with miscarriage, the fibroid is not letting the baby to grow. Because actually when you have your fibroid, it makes your stomach to be hot. You start having hot flashes. So the baby cannot implant, the baby cannot stay. That can also be leading to a series of miscarriages. Get it removed and move on with your life. Instead of keeping it there. A lot of women have fibroid, but some of them is bigger. Everybody have different fibroid. If you have the bigger one, or yours is getting bigger and bigger and bigger, get it removed. Don't keep it there. It's not fancy. Sometimes it can be really, really painful when you have fibroid. Get it removed. And sometimes fibroid do grow back. Yeah, it does. So it's just like you take precaution and mind the kind of food you eat. When you have fibroid, you have to stop eating red meat, avoid meat, any kind of meat. You just need to run away from it. Because by the time you are eating meat every time, it makes the fibroid enlarge. And also when you're taking a fertility pill and you have fibroid, it makes it grow bigger. Yes. It makes your fibroid grow bigger when you're taking a fertility pill. That's why I said on my first video and say, if you have fibroid and you have cysts, that is not the best time for you to take fertility treatment or fertility pill to boost your ovaries or to make you have more eggs. You should get it removed first. That's the first thing. Because by the time you're taking a fertility treatment, you're taking medication to boost your. So they're gonna get increase in size, and you don't want that. Then your stomach is gonna be very bloated, very big, and it can be really, really painful when you're having a fibroid. Some people have the kind of fibroid when they see their menstrual cycle, when they're on their period, it doesn't stop. It can even last up to 2 weeks, even a month. That is the cases of some people's fibroid. Why some people cases, they don't even have pains, their period is still normal, but it can be causing miscarriages. It can also cause the baby not to come. And it's going to be very difficult for you to get pregnant while the fibroid is still there. So you have to get it removed. My advice is get it removed and move on with your life. You can get it removed and get pregnant immediately. I did it. I got my fibroid removed, and the following month I got pregnant, and I didn't even know I was pregnant because I just had sex just once. I got that I was pregnant after when I was already 7 weeks gone. I said it on my my first video. So it's not a big deal. When you are diagnosed, the doctor already told you, your physician already told you, you have fibroid, you need to remove it for the baby to come. Remove it. Do not delay. Don't just stay there and say, oh, you're so scared of. A lot of people are scared of surgery, operation, But trust me, you're gonna be fine, so that the baby can come instead of just staying there and taking pills upon pills. It's not healthy for your. Yeah, so another thing we're going to be talking about is this particular one is very, very common, especially for women. Never you lie to your gynecologist. If you go to see a gynecologist regarding infertility, don't lie to them. Tell them the whole truth. Because I'll use myself as an example. 2010, when I decided to have a baby, yeah, when I said decided, like before then I wasn't really ready. 2010, I'm like, okay, let me come and start to have my own kids, So I met with a gynecologist that was evaluating me, and he asked this, so it's a deep question, like, oh, have you been pregnant before? Have you had a DNC before? And I said, oh, I've never had a DNC before. I've never gotten pregnant before. I lied. And he said, oh, okay. For how long have you been with your partner? And I said, 6 years. He said, 6 years? Oh, does your partner use condom or any form of protection? Or do you take contraceptive? I said, no. And he was like, and you've never gotten pregnant before? And I said, yes, I've never gotten pregnant. I lied. So based on what I told him, he was like, oh, that's going to be a very big issue. And really, it's not really too big, but it can be under what we're going to do. You're going to do some blood work, some ultrasounds, and some evaluation and all that, So if I was being really truthful to him and say, yeah, for those 6 years, I've done like 3 DNC or 4 DNC, then he can say, okay, then you are fertile. And I said, oh, I've never had a DNC before. I've never gotten pregnant before. I lied. And he said, oh, okay. For how long have you been with your partner? And I said, 6 years. He said, 6 years? Oh, does your partner use condom or any form of protection? Or do you take contraceptive? I said, no. And he was like, and you've never gotten pregnant before? And I said, yes, I've never gotten pregnant. I lied. So based on what I told him is what he was evaluating me for, and he was like, okay, you have to just do some tests, some ultrasound and all that. Then I got home, I spoke to someone about it, and the person told me, oh no, you shouldn't have, because when you are dealing with a gynecologist, you really need to be truthful to them. You were supposed to tell him everything. Okay, for those 6 years, I was pregnant 3 or 4 times, or I had a DNC, Then he's going to ask you, how did you do your DNC? Was it through the doctor? Did you take medication? But I lied. I wasn't truthful. Then on my next appointment, I went there and I told him, oh, please, my first appointment with you, I wasn't really too comfortable telling you everything, but now I think I'm more comfortable, and I think I lied on the first one. He said, really? And I said, yeah. He said, okay, so do you want to talk to me now? I said, yes. And then I opened up to him and I told him everything. And he was like, okay, no problem. We're going to wait for your test, your ultrasound results, so we can see everything. Then we pick it up from there. That is it. Don't lie to your gynecologist. Don't lie to your doctor. Be very, very truthful to them, so that they can know where the problem lies and how they're going to best treat you. Because imagine you dating somebody for 6 years, 10 years, and you tell your gynecologist you've never gotten pregnant and you're not taking contraceptive. If your partner is not taking contraceptive and you are not taking any and you didn't get pregnant for those 6 years, your partner also needs to come for evaluation. And I'm like, okay, my partner doesn't live in the same country with me. I'm just the only one here. And like, okay, but you want to start fertility treatment. So how if now you start taking your treatment, your medication, everything, so how are you going to have sex? So how is the baby going to come? And I'm like, yeah, I just want to just do evaluation to make sure I'm okay because I'm traveling pretty very soon. And he said, oh, okay, I got it. And I did all my evaluation and boom, I went to out Nigeria, came back again, pregnancy, miscarriage, and everything. So I always like to use myself as the example because I've gone through it. I know how it is in and out. So I don't want anybody out there and the person is waiting to have kids, or probably they're waiting to have the second child or the third child or the fourth child and the baby is not coming. So that's why I say, you know what, let me share these ideas with people so that people can know the mistake that they make while they are waiting patiently trying to get pregnant. Don't make those mistakes. Be very truthful to your doctor, okay, so that they can better know how to treat you, know the right treatment for you. You know, instead of you going there and tell them, oh no, I've not done D&C before, oh no, I've not gotten pregnant before, oh no, I just got this virgin, and meanwhile you got this virgin like 10 or 20 years ago, you know. So you're not helping yourself. So that's the another thing we're going to also be talking about now. I'm going to be talking about the male. So you are a man and your wife is just going every time a fertility clinic and you're sitting down there. You're not going to fertility clinic, you're not doing evaluation, you're not doing any analysis for yourself to make sure you are okay, to get certification to make sure you are okay. It's very, very wrong. You also have a vital role to play. When you both are looking for a child, you have just the same way the woman have a vital role to play. You as the man also have the vital role to play. If you have been diagnosed and your doctor told you, oh, your sperm is okay, you did your semen analysis, everything is fine. So how can you help your wife in this case? Help reduce her stress. Do not start telling her things that was going to get her upset every time, or you remind her of her childlessness, or you remind her of her not being pregnant. It's very, very wrong. When a woman, it can be very, very challenging for the woman, okay? So that's the most time you have to show her more love, more care. Come to the house early from work. Don't stay outside too late, you know. Whenever she needs you, whenever both of you needs to have sex, do not deprive her of that, because that might just be the time she might be ovulating and she's calling upon you and you will say, oh, I'm tired. No, even when you are tired, please, my brother, still try and do it. Perform your duty, you know, because you never can tell when is the right day. And for partners trying to get pregnant, please do not have dates and time when you have to say, oh, this is the day, this is the time we have to have sex. No, you should have it every day, 2-3 times, anytime, as your strength and your power can carry you. Do it every time. Have sex every time, because you don't know when the baby is going to come. You might just be that woman that doesn't even know how to calculate ovulation. And another thing I need to also mention here, if you're trying to get pregnant, try and have your ovulation kit, a pregnancy kit. You know, also you can also get the dollar shop one, or if you live in the UK, £1 or $1. You know, there is this test a strip is $1. You test it with your early morning urine. They also have the one for ovulation. Get it. It's not expensive. You know, so when you finish your period, I will advise like the 12th day after your period, day 12 of your period. Let's say for example you started your period on the 1st. On day 12, you can start testing for ovulation, because from day 12 to day 16 you should ovulate in between those days. So early in the morning, take your morning So take your morning urine and test it. If you are ovulating and your partner is getting ready for work, let him know. Tell him, oh, you are ovulating, please, you guys, this is the time for you guys to have sex. Then when he comes back again, have sex. For those 3 days, keep checking. When you check day 12, you are not ovulating. 13, you check, you are not ovulating. 14, you're supposed to ovulate. When you have the 28-day cycle, you're supposed to ovulate on the 14th day, on the 15th day. Even some people ovulate on their 13th day. So try and have the ovulation kit at home. So when you test for ovulation and you are ovulating, check it till day 17. Make sure you have sex on those days that you are ovulating. You can have it morning, afternoon, evening. You can have it in the evening. You can have it in the morning. And when you have those sex, stay in your bed. Sleep off. Sleep up. Relax. Let the sperm swim in. Let it go in. And also, if you and your partner are the kind of people that uses lubricants to have sex, please try and read through the lubricant that you are using, because there are some lubricant that is very, very bad. Some lubricant will kill the cell of your husband's sperm and not make it fertile. So you have to look through, you have to read it. I'm not giving a prescription, but I know that Preside is very good. It's a very good lubricant for people trying to get pregnant. So you can try Preside. You can get it at the drugstore. It's not really too expensive. You can also use that. Please, if you are a woman here trying to conceive, trying to get pregnant, try and have ovulation kits and pregnancy kits. Because after your ovulation, 2 weeks after your ovulation, that is a good time for you to start checking if you are pregnant. And after your ovulation, and you know that you had sex throughout those days you were ovulating, stop sex at that time. Because then you are giving your body time to relax. So your body is going to be relaxed. So when the egg is trying to gather up, you don't want anything to go in there and start shaking it, boom, 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 boom. Because it's just like you taking a dirty water. You leave it to settle down. But by the time you go there, every time you're shaking up the water, it's not going to relax. It's not going to be settled. So after you test for ovulation and you see for those 3 days you were ovulating, you actually had quality sex. Then you test again and see that you are no longer ovulating. That is the time you should stop having sex. Because 2 weeks after your ovulation, you should start testing for pregnancy. You don't want the situation whereby throughout your ovulation you already had sex and you still continue having sex. Your body is not relaxed. No, you don't want that. Give your body 1 week or 8 days, 9 days to relax. So after 8 days, 9 days, your body is more relaxed. Then you can start using those of pregnancy strip to test for pregnancy. Early morning urine with a clean container. Clean up your container. Take a wipe. You can use a baby wipe. Take a baby wipe. Clean your vagina, the vulva. Clean it make sure it's very clean. Take a very clean container that doesn't have water in it. Very dry. Pee on it and put a little of the pee into the if you are using the one from the dollar shop, there is a spot where you put the urine. So if it shows 2 lines, that means you are pregnant. If it shows 1 line, that means you are not pregnant. If it shows 1 line and another 1 thick line and a faint line, that means you are closer to pregnancy. There might be a tendency of pregnancy. The same thing goes with when you are testing for ovulation. When you test for ovulation for the same procedure and you see 1 thick line, that means you are not ovulating when you see the 1 thick line. But when you see 1 thick line and another faint line, that means you are close to your ovulation. That is the time you should start having sex. Yeah. Then if you see 2 thick line, that is the day, probably 100% your egg is going to release on that day. It's a very good time also to have sex. Morning, afternoon, evening. When your husband come back from work, okay, bang, bang, bang. Do not give yourself space if you have the strength. And also for the men, when you guys are trying to your wife is trying to get pregnant, trying to have a baby, try and reduce your intake of caffeine booster. When I say booster, those energy drinks, reduce it. It's very, very harmful when you're trying to get your wife pregnant. Do not take it. That is not the right time for you to take a, you know. So for the woman, also try and reduce your intake of caffeine, like coffee. Reduce it, because those coffee, caffeinated drink, energy boost, all those things, your husband is going to reduce it. You also, as a woman, you also have to reduce your intake of it. Don't take too much. Too much of everything is bad. So that's it. So always text for ovulation, always text for pregnancy. 2 weeks after you ovulate, text for pregnancy. When you see the 2 tick line, when you are testing for pregnancy and you are pregnant, that's the right time to go see your doctor and say, oh, I think I might be pregnant. And your doctor is going to do a blood work and also a urine test for you. And during that process of doing the evaluation, you might be pregnant. And congratulations if you end up being pregnant. So that's it. So after you have been diagnosed of being pregnant, when you're diagnosed of, oh, you're pregnant, your doctor has already told you that you're pregnant, go home and start the process of giving yourself more time to relax. Reduce your stress. Reduce your sex life. That is the time you should reduce your stress life. Your sex life. Because if you are the kind of person that already had 1 or 2 miscarriages, when you are pregnant, sex is a no-no until you've gone for your cervical cartilage, which is when they have to protect the womb from another miscarriage. Okay, so I'll be ending this video here now. See you on my next video. Take care. Bye for now. I remain your humble girl, Violet. Please follow my handle. I have my business Instagram page, Fabulous Kids 123. I have my personal Instagram page, Violet Love Ugwe. I have my personal Facebook page, Violet Love Ugwe, and I also have my talk show page, Mama na Mama, on Facebook. Please follow, share my video, and like my video. Thank you very much. See you on my next topic. Bye. Please, you can leave your comment below. Any question that you have, you can leave it below. You can also, my WhatsApp number is there. You can also send me a WhatsApp message. I can also guide you through. So I can just give you the guidelines on things to do and things not to do based on experience. Thank you very much. I hope to see you guys on my next video. Please share this video, follow my page, so whenever I drop any video, you'll be the first to see it. Thank you. Bye for now. So I can just give you the guidelines on things to do and things not to do based on experience. Thank you very much. I hope to see you guys on my next video. Please share this video, follow my page, so whenever I drop any video, you'll be the first to see it. Thank you.